Welcome to the Thin Within podcast, the show for women who want mental secrets for weight loss mastery. I'm your host, Marna Thall. I'm the owner of thinwithin.com, and I'm here to give you the inside scoop on how to lose weight by mastering your inner game. Diets never worked for me long term, and if you're like 95% of the rest of the human race, they haven't worked long term for you either. Every week, I'll give you tools, techniques, and resources you need to actually succeed in using the power of your mind to lose weight. I can't wait to teach you another mental secret, so let's dive right in. Well, hello everybody. It's Marna here. And the other day in the inner circle, we were talking about COVID and re-entry and the anxiety that it's providing some of my clients. And I think it's a real important area to discuss because there's two types of anxiety that I'm seeing. And what I'm also noticing is that I'm hearing more and more stories of anxiety and nervousness, which is leading to some of you turning to food for comfort. And so let's talk about these two types of COVID re-entry anxiety and how you can avoid overeating. Instead of turning to food, I'd like to offer you a few tools that will help. There are two different types of anxiety that I'm seeing take place with my clients. And you can notice which is the type that you might be struggling with. One, anxiety around whether or not you're going to catch or spread COVID. Anxiety around whether or not you'll catch or spread COVID. The second anxiety that I'm seeing come up is the anxiety of socializing again. I mean, all of us have fallen out of practice with socializing in one way or another. And some of you are finding that it's anxiety-provoking, starting to go out and socialize, have people over, or maybe you have to clean your house for the first time in a year because you're going to have people over and you don't want to clean your house. Whatever it might be, it is a collective re-entry that I think all of us are feeling in one way or another. And as you can see with both of these different types of anxiety, they're really driven by your brain's worry that you're going to put yourself or someone else in harm's way, or that you will be uncomfortable in socializing or being social. Your brain has worked very, very hard to keep you safe this year. So it's no wonder. It's no wonder. It's your brain's job. And it's the job that it's come to know, especially in this area for the last year and a half. And now it's feeling a little protective, a little concerned about you re-entering and putting yourself out there. And so you might find yourself turning to food. And so let's not take this re-entry out on your body, because gaining weight is only going to frustrate you more, and it's going to lead you to feeling even more unsafe and less likely to interact in social interactions and have more social interactions if you're feeling like your body is not the way you want it to look, or you're feeling self-conscious about your body, or maybe you've gained a little bit of COVID weight and you're finding yourself using that as an excuse from socializing and going out. So let's look at how can you start to really address these anxieties without turning to food. So there are a few things that I recommend. The first thing is be confident in yourself and know what feels comfortable to you. You know you, and you know what feels good to you. Your husband, your partner, your parents, your children, your friends, they all might have different risk tolerance than you. They might feel one way and you might feel another way. And that's perfect. It's okay. This is not about any of them. It's about what feels comfortable for you. So I think it's really important for each and every one of you to get really clear about what your comfort level is right now as things start to reopen and as people are socializing more and more. Write out what you feel comfortable doing and what you might not feel comfortable doing right now. And then I would have you look at what needs to happen for you to feel even more comfortable with going out, with socializing, with feeling that things are more back to normal? What needs to happen for you to feel that way? The second thing I think is important for you to recognize is the rabbit or the hare. Are you a rabbit or are you the hare? You might notice that some of your friends and family members are more like a rabbit or more like a hare. If they're like the rabbit, they're ready to dash out and be seen and go out and do as fast as possible. And if you're more like the hare, that's okay. If you're more like the rabbit, that's okay. What I recommend you doing is if you're having a lot of anxiety about being out in public and going out, then be the hare. You can take things slow and steady. Recently, I was reading an article that Time Magazine did, and a therapist was talking about a psychological strategy called exposure therapy. I'm sure many of you know about exposure therapy, but just to refresh your brains, exposure therapy exposes you safely to confront any source of fear that you're having. So if you were scared of, say, a spider, it would have you safely look at a spider in a box so that you would know, okay, I'm not going to be touched or hurt by that spider. And then the next thing it would have you do is get closer to that box where that spider was. And then you get really close. And then they may take off one side of the box and then the other side. And then you can get closer to it, right? So little by little, you're exposing yourself to the area that has been creating fear. Exposure therapy is oftentimes the gold standard treatment for many fear and anxiety disorders. And it can also be really great when we're talking about COVID. The way you can use exposure therapy to reintegrate is to just slowly begin to re-enter in a way that has you feeling safe and yet slightly moves you into new environments. So if you've been having your groceries delivered, you could start by going to the grocery or standing outside of the grocery store or just sitting in your car in the grocery store shopping lot. And then you could maybe stand outside of the grocery. And then the next thing you could do is you could go into the grocery and buy one thing. And just little by little getting into an experience that feels more and more comfortable. If you'd like to try going out to a restaurant, go at a funky time on the weekdays and see how that feels for you, where there are fewer people there. Go for a walk with a friend, socially distanced or with a mask. Then try a walk without masks if you both have been vaccinated and you feel comfortable. You could try chatting with a friend outside, socially distanced, and see how that feels. Setting small and progressive goals that will confront your fear in a safe way is a recommendation that I strongly have for those of you who are struggling to get back into life, back into feeling comfortable. I also strongly recommend using breath work. Breath work is my go-to. It's something I absolutely love. It's something that we carry around with ourselves everywhere. So I love breath work because I know its power to calm and relax us in just a few seconds. You can use your breath before getting out of the car or doing a new activity. Here's how I would do it. I would place my feet on the ground just to connect and ground myself. And I'd sit for just a few minutes and I'd breathe in through my nose and out through my mouth, telling myself, you're okay. You've got this. And just for a minute or two, breathing in through your nose and out through your mouth can really calm, center, and ground you to then step into the new activity that you may not have done for a while. Another beautiful thing to do as you're re-entering into society, instead of eating, start using your self-talk to really help support you. Now, a big reason why there's so much anxiety is about this lack of safety, this worry, this fear. And so using your self-talk to remind yourself that you're okay. Maybe to tell yourself, it's okay. I've been vaccinated. I can do this. If you've been repeating on autopilot that you're scared or you're fearful and worried this whole last year, then your brain is going to just naturally go there. And so your brain can really benefit from some new programming around feeling safe, around feeling strong. And so you might want to ask your self talk to help support you. Your words that you tell yourself can really positively affect viscerally how you feel, psychologically, obviously, how you feel, and really can help support you to feel safe so that you don't start feeling like you need to turn to food to love, protect, and nurture yourself. Words like, I'm okay. I can do this. I've got this. I'm proud of myself. I'm safe. I'm doing the best I can. Good job for getting out there. Way to go. Those are all words and phrases that will help support you to feel like you can take the next step and that you're safe, that you're okay, you're doing the best you can. And that helps you start to move from a fear-based language into positive solution-based languaging. And two more things I want to bring up. One is reward yourself. When you do something that's been scary or new or anxiety provoking, celebrate yourself by telling yourself how strong, amazing, powerful, and courageous you are. You did it. You faced something that was a little uncomfortable for you. Reward is a huge part of habit formation, and you will more likely keep moving through this anxiety if you reward yourself and recognize yourself for what you've done well. And then lastly, be compassionate with yourself. You've been through quite a year and a half. So be compassionate with yourself. Take care of yourself. Know that food is not going to help you get through this, nurture you through this. It's not a great buddy in this way. But compassion, it's loving, it's kind, and it's such a good friend. So don't forget, you're unique. Your desires and what feels comfortable for you is unique. Honor that, support that, be compassionate with your process. Don't compare because somebody else's process and needs and what feels safe is different than yours, and they're not wrong and you're not wrong. Just be compassionate with where you're at right now. Even if it looks different than somebody else's in your household, that's okay. You do you, you be you, and don't forget, you're amazing. Thank you so much for listening to my podcast. Thank you for continuing to listen. Please, if you know other people that need love and support and the mental work to rewire their brains to think, eat, and live differently, please spread the love. It means more to me than you know. And if you'd like a free resource, take my free course. It'll help you reprogram your mind, change your body, and set you up for real and lasting weight loss success. All right, everybody, have a wonderful day, and I'll talk to all of you soon. Bye for now.